Hi, Don Pelto here. Welcome to the Podiatry Management Minute, episode number 26. So I want to talk today about shock and awe before the visit. So the idea of this actually came from reading some Dan Kennedy work. He talks about marketing and things like that. And Dan has this idea of a shock and awe package. And that's why I have this little kid here with his eyes wide open. And what I find here with this is that when we are meeting our patients and we're meeting them specifically for the first time, I find the best ones are the ones that are knowledgeable about both me and the practice. And one of the easiest ways of doing that is having them look at something before. So let me give you an example. If a patient comes in and let's say they go to Google reviews and you have tons of reviews and they read all those reviews, then what they'll do is they'll come in and say, wow, you have a lot of reviews. And and so it builds trust. If they go and they see you on YouTube and they watch a lot of your videos and then they come and see you for that condition, they're going to be amazed and they are going to be wowed. Well, there's a way you can orchestrate that. And I'm going to put a little link underneath this video. It's my new patient, like a welcome packet, I call it. And it's called a shock and awe. Basically, it's a PDF that I send to patients before they come in, and it has a whole bunch of Google reviews, and it has a whole bunch of information about the practice, about me, about things like that. So that is a way you can kind of awe your patients before they come in versus awing them once they're in. So it's a lot easier to give them a good experience. Now, what would be something very easy that you can do? Instead of when you're getting someone to come in the office, I need you to do all these things. I need you to fill out this paperwork, tell me everything that's wrong with you, do all this other stuff. And you're not really doing everything for them. But what you could do is you could say, hey, here's all the paperwork. But while you're waiting, you're a week or two to come in, here's a couple of links for some patient resources that you can learn about your condition before you come into the office. You can kind of wow them, and you can have a little intro video of yourself talking to your patients. And it really helps that relationship before they come in the office to see you. So I'd love to know what's working for you in terms of awing your patients before they come into the office. I'd like to know, does anyone do any of that? Books that they give away, things that are working really well for them. Please let me know. There's a little link underneath it, or you can